In this video, I'm focusing on the symptoms of tuberculosis. First of all, tuberculosis is caused by a bacteria called Mycobacterium tuberculosis. It's airborne, okay? It is an airborne disease. Now, the bacteria usually attack the lungs, but they can attack any part of the body and can also affect multiple parts of the body at the same time. I had to tell you that because this is going to explain some of the symptoms. There are two types of TB infection. There is, sorry, I've got a stuffy nose. I'm getting over a cold myself. There is, active TB, active tuberculosis, which makes people feel sick and can be spread to others. But then there's latent TB, which is inactive, doesn't make people feel sick, and cannot be spread to others, okay? So you see why I had to tell you that? By the way, I have had latent TB before. When I was a resident doing my medical training, I had to actually take like 9 months of medication for that. TB is not spread by kissing or shaking hands, sharing food or drink or things like that, okay? And you should know that TB is treatable with antibiotics, okay? It's treatable and preventable, so that's good news. Now let's go into the symptoms. So now you have that background, okay? So symptoms of active TB disease depend on where in the body the TB germs are growing, okay? So let's start with active TB germs or like an active TB infection in the lungs. Lung symptoms of active TB are a bad cough that can last 3 weeks or longer, pain in the chest, and another one, coughing up blood or sort of sputum from deep inside the lungs. Now let me tell you, coughing up blood is never good. Coughing up blood is never good. We worry about cancer, we worry about TB, we worry about other things, okay? You need to always be seen, but those are 3 hallmark symptoms. Now let's go to other symptoms of active TB that are sort of what we call generalized. People can get weakness or fatigue, like weight loss, no appetite, chills, fever, like sweating at night. We call those constitutional symptoms because those symptoms can happen almost anytime somebody's kind of ill, okay? Now let's go to symptoms of active TB disease in other parts of the body. Now the symptoms are going to depend on the other parts of the body that are affected. So if there's tuberculosis disease of the lymph nodes, that may cause like firm red or purple swelling under the skin. If you've got TB in your kidneys, it may cause blood in your urine. If you've got TB in your spine, it could cause back pain. TB of the throat, the larynx, can cause hoarseness. You see what I mean? Okay, this is why I told you all this stuff in the beginning. Now let's go to inactive TB. This is the type of TB that I had years ago, latent TB. So remember, people with inactive TB do not have symptoms of TB disease. However, if they don't get treated, they can develop active TB disease and become sick. And this is why when I was a resident years ago and I had latent TB and active TB, I had to be treated for it, okay? Guys, I hope this is helpful. Remember, there are antibiotics to treat this. That is a good thing. If you have any symptoms that are abnormal, see your doctor. Share this video with other people. I'm Dr. Jen. Please subscribe to my channel. I'm on TikTok, Instagram, LinkedIn, etc. Go and subscribe to my free weekly health newsletter at drjencaudle.com.